This is KMAD4PEACE. Welcome. We're going to be discussing today COVID-19 and some of the things that we want to debunk and maybe just even have a discussion about, and some of our fears. I appreciate your time and welcome. We're going to be today interviewing Dr. Stephanie Callison. Okay, so this is KMAD4PEACE. Hi everybody, welcome back. And today I'm going to be doing an interview with a great close friend of my daughter's and our family, Dr. Stephanie Rayos. And she might be giving us a little insight on what it is to be a doctor in this COVID-19 climate, and her perspectives maybe as a mother. Let's see what we'll get. And welcome. Thank you for joining us. Hi Stephanie, how are you? Hi Dr. Rayos, I might want to add. And thank you for
having me, Karen.
Thank you for giving me your time. I really am appreciative of it. It's kind of hard now for us all and this environment, and especially since I've been I just hadn't looked at the news for a while. I just decided to turn my TV off. I didn't want to see it. And kind of just was feeling like, let me create my own world and environment of happiness so that that level of anxiety that I was feeling could kind of come down. Because it is scary when you turn on the television and maybe, I know your children probably aren't old, well your child is not old enough for you to have to explain what they're seeing on the news with people storming the Capitol acting like, some, I don't know, playground kids. I don't want to, make it sound like it's so minimal. But it's seeming that this COVID-19 has caused everyone to come unhinged. Everybody from having their own views about what the big pharma is doing, the cost of medicine, Medicare, and from the beginning and inception of what I have been seeing, it seems to be just like a fight over medical cost.
Sure.
Elderly in hospitals and nursing homes, people being afraid to have their families there. It's even given me pause for thought to say I need to exercise more. So I've even gone to the extent and degree where I walk my dogs more often, just to say I need to stay as healthy as possible, because I'm scared of the hospitals. I'm scared of the doctor's office. Even my own doctor's scared for me to come in. So you as a doctor, what's been your take and what's been your stand on how to go forward, even with your own health and your family's health?
Yeah, I think COVID has definitely been something that's taken a front seat for pretty much everybody since March. From a medical standpoint, we're glad that we know a lot more than we did when we started. Mm-hmm. And we're also, I think, at least locally and in the state of Michigan, I think that we're really more prepared for caring for patients now, and having less unknowns than we did before. Even like as we're doing this interview through Zoom, I mean, that's a safe way to stay connected with people, and actually that is one option to seek care with your physician. Mm-hmm. And so I think that the answer for everyone's different. Mm-hmm. It's not trivial to go into a medical office or to go to a hospital, but mm-hmm. if you indeed are somebody that needs medical care, we don't want you to feel afraid of coming in, because we want you to know that as medical professionals, we all are collectively doing the best to take precautions to keep not only our medical staff safe, but also to keep patients safe. So mm-hmm. if somebody has a true emergency or something that needs attention, we don't want anyone to feel like they can't come in. We want you to come in because it's important to be seen and cared for in a timely fashion. Mm-hmm. And we are taking additional precautions on an everyday basis now. Mm-hmm. So, for example, I work in the operating room setting, and so anybody that comes for surgery, we are testing everybody for COVID, because we want to know how to, manage that patient the right way. We want to know if they need any special accommodations for as far as room or treatment. We want to make sure that we're keeping our other patients safe, and we want to keep our medical staff safe. So increased testing has been one big thing. We're also, and then everybody has been wearing it's pretty much universal masking for everybody. So patients are required to wear masks, medical staff are required to wear masks. And that's just one safety measure that we think is really important to preventing the spread of COVID and doing our best to limit the spread and the impact of the disease. And then also when people come for special procedures like surgeries, for example, or something that's more involved, as medical professionals, we're making sure that we are protecting everybody by wearing additional what we call PPE, or personal protective equipment.
Okay.
So we're wearing additional things like masks, respirators, like what you might hear is like an N95, and then gowns, gloves if we need to. So always gloves, but the gown just depending on what the patient's medical status is. So I think the bottom line is we are still very motivated to take care of our patients, and we just, all we really need to know is who needs to step up and be cared for. We did see a lot of drop off in some of the surgeries initially that didn't need to be done, but I'm sure that there was hesitation with some people as far as if they had something that should be done from a medical standpoint, but just that nervousness about being in a hospital environment with people with disease. But I think especially now that we're more than 9 months into the pandemic, I feel confident that we're prepared to take care of as many people as we need to, and also, at least from a local standpoint in Michigan, we've been fortunate to not see those initial, the caseload has not been as overwhelming as it was back in the spring.
Okay. Now, as I listen to some of what you just mentioned as far as surgeries go, I've heard a lot and of course gotten phone calls from people who stated that they were due surgeries, and then and as you said, some drop off from those surgeries, but in need of certain situations where they were major surgeries, and I was afraid for them, and then afraid for the staff as well. It's just, and I just want to thank you as a first responding participant, medical care person. I really, I thank you, because that's something to take into consideration going in an environment where some people are careless with not wanting to wear masks. And then in other situations, even when I go out places, they say, well, if you have an underlying medical condition that the mask makes you feel that you can't breathe, then you don't have to wear one. Before I go off into other parts of this topic and the subject matter, what do you think of that? Because isn't that a risk in itself if you do have an underlying medical condition and you choose not to wear a mask? Doesn't that open a person up for catching the COVID, if you will?
So I think that the short answer is yes. Anytime that you, especially somebody with an underlying medical condition, anybody that has to go out into public and be surrounded by people that are not either within their family bubble or a housing bubble, will open them up to extra exposure that they wouldn't normally be exposed to if you were to stay home. And I think that's a challenge, because there are, for example, let's say there's somebody that is, for example, very sick from a lung standpoint, and they might be on the transplant list to receive.
And I've met someone just like that.
So poor that it's hard for them to breathe just sitting down. So let alone having them go walk out to the grocery store,
right?
Or to even put on a mask would be unthinkable for some of these people. And so I think that everybody has the right answer for themselves. I think people that are especially ill have that additional challenge where if they can't wear a mask safely, then they are, in my opinion, they'd be at additional risk just because they can't cover themselves up. And, so I think that part of that also plays in. Oh yeah, and the only other thing I was going to say is that, it's in that part, it's partly this.
So it's just a little small delay, and I see you froze up, so you're probably completing your sentence. I'm going to give you a second or two to kind of catch up. Okay, so while Stephanie recovers, you're back. Can you hear me? Yeah, kind of clicked off there for a second. I was just going to say something.
Back, Karen.
Okay, all right.
There we go.
Okay. So you were saying from a standpoint of a person, because it's kind of a, how they say the medicine can work. It's the lesser of two evils. You can use it, and so I get that part that you're saying, because I even, have a condition myself where sometimes I cannot breathe, and the mask that I bought comes with that filter in it, and I found myself having to take it out and still put the mask on. But still, as I breathe in, I'm sucking in the material, and it's blocking my airway. So I'm finding that I'm adjusting it constantly. My glasses are fogging up. So, but for safety reasons, I still, slap it on. And if not, some of the places that I come to shop have masks at the door, and I might just grab one of those and put one of those on, because it's a little bit looser. But then in the back of my mind, I'm thinking, how much safer is that for me to be doing that? And even as you walk past people. Now, this is the other thing I want to mention. This thing I've heard that it's going to be this second wave. Now, my theory on the second wave thing, and then what I was also told by the doctor, is that if you don't get a flu shot and you catch the COVID, you got this double whammy that you could die within a month. What's your take on that?
Yeah, so I think to answer your question about the second wave, it's hard to say what wave we're in, but certainly as a nation, if you look at the caseload and the number of hospitalizations and the number, unfortunately, of deaths per day,
right,
we are in some additional wave relative to in the spring. But the one thing I'll say that's very regional, feeling safe about having the COVID vaccine.
Yeah, are you going to take this new vaccine?
So the idea is, let me just preference by saying, so in the state of Michigan, vaccines have been offered to different phases at different times. So currently we're in what we call phase 1A, which basically includes healthcare workers and some frontline workers. And then I know that soon, according to Governor Whitmer, that we'll be phasing into 1B, which includes adults 65 and over, and then expands into essential workers, childcare workers, teachers. So, initially before the vaccines were available, the issue with the vaccines being new is that there's not a lot of data. But the good thing is that they did do very robust trials that included, thousands of willing volunteers that were. Exactly, and these weren't like people that were involuntary. These were very much people that wanted to help. They wanted to help to demonstrate that the vaccine was, one, safe, and two, that it works. And so,
let me ask you: hey Doc, let me ask you something. Were there willing volunteers that created the vaccine that volunteered themselves?
I don't know that off the top of my head, but I can only assume that was the case. So the studies that were, we're in the order of thousands, 40,000, 50,000 people per study. And, each vaccine did their own studies. And just because we're in in this pandemic, and it's not going to get any better until we really start to have people get vaccinated and have people, keep doing what they're supposed to be doing as far as social distancing and masks and hygiene. So I guess the short story is we were very excited when the vaccines came out.
Okay.
It does give us a little pause in the sense that, we don't have the luxury of saying, well, this vaccine's worked for the last year. It's because we need to have vaccines available now. But from a medical care standpoint, I can tell you that because we're at such high risk of getting COVID from just because of our jobs and our exposure to patients, and the fact that, that there's just, it's a numbers game for us, because we don't have the luxury of quarantining or keeping within our own bubble. A lot of us have said, the risk of getting COVID is a lot worse than the risk of something, a potential bad reaction to a vaccine, because they've had these trials done with that many people. And at least what we can say is at least we have a few months of data to say that no major adverse reaction happened. There were no deaths. There were no.
Okay, because that was going to be my next question. Would you think they would be honest enough to tell us that there were actual deaths from taking this vaccine? Because don't they have to use some of the antibodies from the actual virus itself to create the vaccine?
So one, I think, yes, they are held, the companies are held to a very high standard. I know that, for example, the FDA wanted to be very clear that even though there was an emergency issuance of permission to give the vaccine, that it was only because they had those trials finished to the point where they said, okay, it's been this long, there were these many people, that number is robust, and they tracked, all the reactions, and the only ones that they could come up with were ones that were, something that can happen like with any other vaccine. So for example, having a fever, having an allergic reaction to it, those are all possible with any other vaccine, and they have happened with the COVID vaccine, but they weren't things that gave pause, like this person, nobody died, and I do believe that they wouldn't falsify that information.
But you know what, though? The other thing that I would have to think about when you talk about this is that since President Trump decided to deregulate a lot of various agencies under his command, then people in the back of their mind would kind of question what truth is it? Where's that truth coming from? Is it the truth of the people that are really fighting for the health of the people, or is it just because of political aspirations and whatever they're looking for? Is it because he decided to take the regulation away that would cause them to be honest? So it's like really scary, for people right now. And that's kind of what they're thinking about. Like, okay, where's this information coming from, and whose side are you on when you give it to us? And is it Big Pharma's way of making this money to make us feel comfortable? So if those people are in your pocket, are they saying it on the behalf of themselves, or is this the medical community fighting for actual the health of humankind and saying this is not that? We're ignoring them, and we're going to make sure we all are safe, and with the medical community, and just like kind of keeping doctors restrictive, even in the beginning of COVID, saying we're just doing protocols, so no underlying conditions, we're not treating that right now, it's about the COVID, put those respirators on, or we're not getting enough respirators. So it's like all this rhetoric and confusion going on back and forth. How do you guys know who to trust, and if you feel safe enough that, okay, we're going to go ahead and do this?
Yeah, and I think you mentioned a lot of you mentioned the word politics, and unfortunately we were in a time when there wasn't a big election coming up. And I in my reading of the news and just hearing, and I think that a lot of people will say that there has been less than ideal of a government response to the pandemic. And I hope that things will improve moving forward. But as far as rushing the vaccine, or, I think everyone had that in the back of their minds in the medical field. But the thing that gave us more confidence is that I think that had we seen more politicization of it, we would then in my opinion, we would have seen a vaccine approved before the election,
Right.
not after.
Right.
And I think that there, when the
because he's still really in power. If you kind of look at it, the transition is not done yet. So it's like, okay, so who's on our side right now?
True. I mean, in my opinion, I don't think that our current president has much input at this point as far as the medical decisions or, making decisions about COVID at this point, to be honest. And that's just my opinion. And, I don't know what the truth is. But my opinion about the vaccine was it would have seemed suspicious if they didn't complete their robust trials with all the right numbers of people, with all the studying of how many people got sick or didn't get sick from the vaccine, at least up to the point that they could do. But because they didn't actually have that emergency approval until December, tells me that in my mind, I don't think they rushed. I think they did the best they could.
Right, within the means that they had.
Vaccine, but we're not going to rush it because we know that the public will not be confident in getting a vaccine if it was just something they said, oh, just go and do it and be guinea pigs. That's not
right.
I did see specific news that said that was at the forefront of the major medical organizations. So the CDC, the FDA, the leadership there was very concerned about not wanting to make this political. And so,
and that was my concern. And I was hoping that they would be strong enough in their fight to just make that so.
And I believe they have been. I don't have any hesitation about the safety of the vaccine. The only the limiting thing that nobody can change is that we just don't have long-term data on the new vaccines.
Right. And so we're the history that's going to be made when that. Yeah, I get what you're saying.
Yeah.
When it's finally written down, basically. It has to be some time.
There is reassurance in the sense that the technology from the vaccines that are available, the Moderna and the Pfizer, it actually has been around for decades. So since like the 1980s, 1990s, they have been doing studies on them. It's just that it never was used as a technology in humans. Right. But it's not like they just looked at it in March and said,
I get what you're saying, especially when I started the reading about the doctor that had caught the SARS and the nurse they had to catch when she came back in, and they were talking about the combination of these, the different diseases that were together that caused them to study the background of this COVID-19. So I get what you're saying. And so, yeah, I realized that they've been doing this for a long time, but it just seemed like it was terrible that they had to wait till this happened to decide that they were going to finally have some kind of vaccine, just like, okay, here we go. But now everybody's afraid, and everybody doesn't read medical journals, and everybody doesn't know to check in and see what the FDA's approved or not approved.
Right.
They've been complaining about what the FDA doesn't do as far as what they don't inspect and what they don't do, and what the CDC will and won't do. And they talk about a lot of coffin purchases, and so it almost looks like they're expecting us all to keel over fairly quickly. And look out, Georgia, here comes a bunch of bodies. It's sad to say that, but in closing, I really appreciate your time. I really appreciate your clarity, and I really appreciate you breaking it down so that we all get a better understanding of how we should be looking at this, as opposed to being so afraid of this vaccine. And that's what I wanted to give my viewers, and I'm glad that you took the time out, even though it took so long. We're supposed to do it earlier today, but I'm so grateful to you for taking, and thank your family, time out to give us your take on this, and as a mom too as well. And I feel a little bit more comfortable after this interview now that we've had it. And thank you and congratulations again, Dr. Callison, right?
Yeah.
Did you change it from Dr. Rayos to Dr. Callison?
Thank you. Yes. I appreciate your time, Karen. I applaud you for wanting to put out information helpful to everybody.
Right. Because I don't want anybody to feel like, that, because sometimes when we look at the news, it's like I'm screaming at TV, like, come on, tell us. And then it's like they never get to the point, and it's questions that I wanted to, really kind of have answered. I know every question's not going to be the answer I might be looking for, but a little clarity and something to make me feel a little bit more comfortable, as I'm sure that other people are probably feeling the same way. Even the elderly, before they go to the doctor, people afraid to get on transportation buses just to go and get maybe their dialysis done, or just get a shot, or just a checkup, you know.
I guess that's the thing is, I think they use that term essential business only on buses. And I think that they're trying to tell people, like, if you don't have to go out, then
don't.
Maybe you shouldn't. But if you got to go and get your dialysis, pick up your meds, I mean, those are essential things for life.
It is. It is. Thank you, doctor, and I really appreciate you. And again, congratulations, and hopefully we'll be visiting one of these days outside of this bubble.
Thank you.
And this is KMAD4PEACE, and we're signing off. And thank you.
We'll get there, right?
Yes, we will. We're going to get there. Thank you, Steph.